somebody has a UTI, burning sensation when they pee, sometimes suprapubic pain. They have recently been on nitrofurantoin for 3 days. After, you still have the symptoms, so it didn't work at all. In this case, what would you do? Obviously, you follow the antibiotic treatment algorithm for a lower UTI. Bearing in mind, in this case, you have to make sure you've ruled out any signs of like pyelonephritis, rigors, flank pain, all of that stuff. You want to make sure they don't have pyelonephritis, and then you can confirm that it's a lower UTI. But in this case, imagine the person has tried nitrofurantoin, still have the symptoms, so essentially that didn't work. Possible that it could have been resistant to it. We haven't got the cultures back. Now, in this case, what do? Do we go to the next antibiotic? I guess, yeah, you would do that, especially if you haven't got the sensitivities back. But then in this case, imagine they're allergic to penicillin, because usually you can either use nitro, trimethoprim, or then you can use pivmecillinam. And after that is like other antibiotics. But then, yeah, if they're allergic to penicillin, you can't use the pivmecillinam. I think I'm saying it right. But also with trimethoprim is a weird one, because that one, in certain areas, depending on the antimicrobial resistant stuff, yeah, in certain areas they advise against it unless you have specific confirmed sensitivities that the UTI bacterium is sensitive to it and not resistant, then you use it. So if you can't use trimethoprim and you can't use nitrofurantoin, well, not that you can't, but anyway, yeah, so can't do nitro, advice against trimethoprim, pivmecillinam, allergic to penicillin. Then we have fosfomycin, which I'd never used before, but I'm actually just saying this video because I had to use fosfomycin once and I was surprised that it's only 1 dose. So for fosfomycin and a UTI is 1 dose. So yeah, all of that rambling just to say that I was surprised that it was just 1 dose. But that's kind of like, you know, with gonorrhea, it's like a shot of IM, 1 antibiotic. But yeah, I always find it interesting when it's just 1 dose for an antibiotic. But yeah, that's all I want to say.